Hello everyone. I'm Kamar Mahmood, and I will be presenting a part of my PhD research on a very pressing issue, not only at Pakistan level, but at it's a global issue of antimicrobial resistance. And more specifically, I will be talking about the big factors behind the development of antimicrobial resistance. Yeah. Thank you. So my presentation will be in two parts. First part is the establishment of dose-based metrics to quantify antimicrobials, and the second part will be focused on the actual quantification of antimicrobial use on the conventional broiler farms in Pakistan. So first, a little about the Pakistan's broiler industry. We have a huge, a big one broiler industry, rearing 1.7 billion broilers. Yep, thank you. So this big broiler industry is meeting the needs of a huge human population of around 241.5 million. And so in the production system, we have 75% intensive commercial production of broilers, which is making 32%, roughly 32% of total meat production of Pakistan. And the antimicrobials are used, in big amounts. We all are, I think, familiar with the therapeutic use. It's also used as prophylactic, and there is also use of AGPs or antimicrobial growth promoters. So first, I want to highlight why we need to quantify antimicrobials. Well, we hear a lot about antimicrobial resistance every day. This is really a big challenge. But let's focus on the factors behind the development of antimicrobial resistance. So, among all many big factors, antimicrobial use is a main factor which leads to the development of antimicrobial resistance. So it's not only the underdosing, it's the overdosing as well. So that's why I put imprudent use. So imprudent use of antimicrobial will lead to antimicrobial resistance. So in order to reduce the risk of AMR, we need to understand the trends and volumes of antimicrobials used. And quantification of antimicrobials is the first step in this regard. So by answering when we need to administer really the antibiotics, how we need to do this, how much we should administer, and why we need this whole bubble is called antimicrobial stewardship. So as Lord Kelvin rightly said, if you cannot measure something, we cannot manage or reduce it. So given this, the objective of our study was to quantify on-farm antimicrobial use on conventional broiler farms in Punjab, Pakistan. So a little bit about how to quantify antimicrobials. Well, there are three main indicators. First one is mass-based indicator, where we use milligram of active substance of antimicrobial divided by the kilogram of the animals, of the broilers. Second one method is the count-based. This is based on the number of days animals are exposed to antimicrobials over the full length of production cycle. The third one is a dose-based indicator. This is based on two kind of doses, defined daily dose and defined course dose. Please bear with me for these abbreviations, DDD and DCD, and I will talk a lot about this in the coming slides. So what are the DDD and DCD? So defined daily dose is the average recommended dose of an active substance per day per kilogram of animal. And defined DCD is the average recommended dose of an active substance per treatment course per kilogram of the broiler. So, and where in the formula, in the quantification, these two doses are used. Well, it's number of parameters here you can see. We calculate the treatment incidence. based on these two doses. So if we calculate treatment incidence based on defined daily dose, that tells us the percentage of time the broilers are being treated with antimicrobials out of 100 production days. And similarly, if we use the defined course dose, that tells us the number of treatment courses out of 100 production days. So the European Medicine Agency, they developed in 2015 to 2016 a list of defined daily and defined course doses to be used in EU member states. But we didn't have such kind of list for Pakistan. So one way to go was we just rely on the European Medicine Agency values, and we quantify the antimicrobials. But there was a hypothesis was it could be different given the legislation in Europe is totally different. I mean, the whole rearing of the broiler production is a very different, especially with the regulatory framework as this is in Pakistan. So we thought it could maybe also, we have a lot of antimicrobials for preventive use, which is not really the practice in Europe, and they don't have DDT and DCT values for prophylactic use of antimicrobials. So these were the reasons that pushed us to make DDT and DCT list for Pakistan first before we quantified the antimicrobials. So the objective to quantify unfirm antimicrobial use that introduced a new study first to establish these indicators for antimicrobials used in Pakistan. So for data collection, we relied on farm record registers, and a farm veterinarian was always accompanied with us. They also provided when there was some less information, some inconsistencies in the farm record registers. So the farm veterinarian, they were the consultant on those farms. So they helped us a lot in this data collection. So we used a questionnaire for data collection on antimicrobial usage, and for making the DDDs, we relied on the SPCs. For those who don't know, SPC is summary of product characteristics. So it's normally the leaflet of medicines we see mentioning the concentration, duration of antimicrobial, and the dose of antimicrobial. So this is the leaflets, and there were sadly no SPCs maintained by the regulatory authorities. So we had to rely on the SPCs provided for pharmaceutical companies. For study design, we did a cross-sectional survey across Punjab on 100 broiler farms. It was a convenient sampling, but we tried to maintain a regional stratification. So we get representation from all regions of Punjab, as you can see in this map here. So it was all the conventional farms. The inclusion criteria was at least 20,000 birds per flock and all in all production system. And the length of production cycle would be more than 35 days. So why we chose Punjab? Because 70% intensive production is based in province Punjab. I will be a bit quick here. So how we assign DDD and DCD metrics? First, we did some standardization. The drug derivatives, we converted them into active moiety. What is active moiety? That is the part of antimicrobial which actually performs the chemical reaction from the drug. Like, for example, if you see amoxicillin trihydrate, the amoxicillin is 0.86 milligram out of 1 mg. So we converted all the drug derivatives to their active moiety molecules. In the second phase, we converted all the dosage given in SPCs. There was a whole mess of units in the SPCs, as you can see. So we had to convert them all to milligram per kilogram body weight. This is normally the SPC should be a milligram per kilogram body weight, and this is I think the job of the regulatory authorities. They should maintain such documents. And we use the standard feed and water intake, and there was we also saw some synergistic effect, especially for lincomycin and spectinomycin and trimethoprim with sulfur drugs. So how we calculated the defined daily doses? It was the mean recommended doses of all similar active substances with the same load. So if we had, for example, 20 amoxicillin in the data collection, we will check from SPCs what is the recommended dose in every SPC. And we took the mean of all those recommended doses, and that was the defined daily dose of that drug. For defined course dose, we multiplied the mean recommended dose with the treatment duration. So it was the defined course dose. So you can see here we had a list of defined daily and course doses. It was a long list. You can scan, or it will be available later to see the whole list. There were 139 commercial products reported out of these 100 farms. And in 139, there were 41 active substances being used at these 100 farms alone. And there were 17 antimicrobial classes identified under use at these farms. So just how was the prophylactic and therapeutic use in the SPCs? You can see a big number dedicated to both treatment and preventive. It was a big share. So normally the DDDs and DCDs, if we look, for example, at European Medicine Agency values, they don't have DDDs for preventive antimicrobials. But here in Pakistan, we have a big share of preventive use of antimicrobials. So if we ignore this use and we just go for treatment one, I think this will be really an underestimation of the true antimicrobial use. So we had to assign DDDs not only for treatment antimicrobials, but also to preventive antimicrobials. So out of 41, 36 were recommended in SPCs for treatment, and 31 were recommended for both treatment and prevention. If you look at this picture, this is a comparison of European Medicine Agency DDD values and our Pakistani DDD values. So you can see not a single antimicrobial dose is similar with the Europe. So this justified the reason why we made a separate DDD values for Pakistan. So I have highlighted some huge variations in the recommended doses. This is not the used dose. It's alarming to see this is the recommended dose in the SPC in the literatures by the pharmaceutical companies. So after we had this DDD list, now moving forward to the second part, I will show the results for the quantification of antimicrobial usage. So here we use the four different indicators, 4 different metrics we use to quantify. First is the treatment incidence based on defined daily dose. I will not go into the detail because of time. So these two are dose-based indicators. Third, we use the count-based on number of treatment days. And the fourth one was the classical one, milligram per kilogram biomass, or alternatively, it's also used milligram per PCU, population correction unit. So we use 4 these indicators. First, we developed the first 2 dose-based indicators, and then we use 4 these methods to quantify antimicrobials. So coming to the total antimicrobial use, it was 746 group treatments given at 100 farms. And we sampled 6.84 million total broilers, which were reared at these 100 farms. So this explains the mass of the study. So coming to the results, according to treatment incidence, it was 57.7%. So in simple words, what does it mean? The broilers were exposed to antimicrobials almost 60% of their lifetime. So it's a huge number. If we go to a defined course dose, it says out of 100 production days, 13 antimicrobial courses were given to the animals. And based on the actual use dose or number of treatment days, TIUDD, it says that broilers were exposed to antimicrobials 75% of their lifetime. So the first one, TIDDD, is what the literature says, what the SPC say, what is recommended. And TIUDD is what the actual use at the farms was. So 75% of their lifespan, they were exposed to antimicrobials. So the fourth indicator, milligram per kilogram biomass, it was 301 milligram per kg, the usage. So just I put a comparison with other countries just to put the things in a perspective. We did a study, a colleague of mine did a study, the same study from Bangladesh. They had the DDD value of 60. We had the 57.7 is such a competition. So another study from the Europe, it was 9. It was a study from 9 European countries, and an average DDD value for the European countries was 9. So we can see it's really, I think, 5 to 6 times bigger than the European countries. So just at the farm level, you see, it's the median I was taking based on the treatment incidence, based on defined daily dose. The median was 57.7. So if we put this together, just to make comparison, what was the recommended usage and what was the actual use on the farms. So here in the left side of the graph, you see the used daily dose is more than the blue lines, the defined daily dose. What does it say? So the same amount of antimicrobials was used for more days, because the UDD tells us the number of days an animal is exposed to antimicrobials. So with the same amount of antimicrobials, the broilers were being exposed to antimicrobials for more days. That means less quantity of antibiotics was used for such farms. If we have a look at the right form of the graph, it shows the overdosing here. With the same amount of antimicrobials, the broilers were exposed to less quantity of antimicrobials. More quantity of antimicrobials and less number of days. So this tells the real issue here. And now coming to the choice of antimicrobial classes. So the 17 antimicrobial classes were identified. You can see we categorized it according to the WHO categorization: highest priority, critical important, and critical important, highly important, and important antimicrobials. So the percentages are calculated out of total 746 group treatments. So this is also alarming, how the most used antimicrobial classes are the critical ones. So if we go to individual active substances, colistin, enrofloxacin, neomycin, amoxicillin, and benzyl penicillin, they were the top 5 most used active substances. Colistin was almost in every other combination in the species. So overall, 53.6% of total antimicrobials used were critically important for human medicine. So this also puts a concern for the public health. So what was the trends over a whole production cycle? We see a big surge here in the first week. So almost 45% farms treated their broilers in the first week. And the second surge was in the 4th and 5th week of production. This normally happens because of the live bird market. The birds are not, if the farmer is waiting for the prices to go up, and if the prices are not going up, the farmer need to keep the birds, maintain the weight of the birds. So normally they use a lot of prophylactic antibiotics here in the last phase. And this also says a lot about the withdrawal period of the antibiotics, since it's really about to be slaughtered, and the antibiotics at this really critical moment are very threatening. Coming to the main indications, what were the main indications these antimicrobials were used? So the main jump went to respiratory diseases, then followed by enteric diseases, septicemic, generic, and locomotive. So I will not go into the individual diseases list. So in addition to the antimicrobial use, we also assess the biosecurity of these farms to see if there is association between farm biosecurity and antimicrobial usage at the farm. So from the same 100 farms, we collected data on biosecurity as well, in addition to antimicrobial usage. We use the biocheck tool for this. This is really a handy tool. We put it's a long questionnaire digitally available. So we enter all the biosecurity data, and then it compares our scores within a country and also internationally. I will show you the results later. And also it tells the trends at one farm over time. So I did survey this year, I did survey next year. So I can really compare how much the farm was improved in biosecurity scoring. So not every transmission route is equally important. This is something where the biocheck really focuses. So if we see the high risk areas and low risk areas, for example, the movement of animals between farms, it is really a high risk thing, but maybe the feed, the person's breath is not really very important. So we have, for this purpose, the biocheck tool takes the risk of the factors into account. So this is a risk-based scoring system where a weightage is assigned to every biosecurity measure, and then a final score of the farm is calculated. So this tool is a freely it's a freely online available tool. You can use, any farmer can just use this tool to check the biosecurity status of their farm. So the overall biosecurity at the farm level, it was the 49%, and then external biosecurity was 44. The mean value and internal biosecurity was 55%. And these percentages are calculated in accordance with where we fall internationally in comparison to all the database, all the countries' data we have in the biocheck system. Coming to the external and internal biosecurity categories, if you look at the green highlighted area, it's the infrastructure, it's the location of the farm, and disease management. So these three parts were really, good. But if we look in the red highlighted areas, it's the depopulation of broilers, feed and water, and removal of manure and carcass. So these three categories were really underperformed at these farms. So finally, we did an analysis. So we see with the overall biosecurity and external biosecurity, it was significantly associated. But with the internal biosecurity, it was still a negative correlation, but not strongly associated. So what does this say? If the farm biosecurity is improved, we will eventually need to less, it will lead to the less use of antibiotics at the farm. So this might be the solution for the stakeholders, for the farmers to combat with the increasing use of antibiotics. So just last few slides, the key findings. So there was alarmingly high use of antimicrobials compared to other countries, and especially the choice of antimicrobials, we need to revert this from highest priority, critically important, to important antimicrobials. So there was variation in antimicrobial usage practices. As we see, the mean value was 57, but it ranged from 30 to around 100. So the positive thing we can sell to the farmers is that it's possible, the variation shows that it's possible to rear broilers with less use of antibiotics. Maybe we can use this as an example to the high use farmers to see, to convince them to use less antibiotics with the same, almost same production. So the AGPs, we were not able to quantify the antimicrobial growth promoters because normally they are mixed in the feed from the feed mill companies. And also there is no indication of, and they are given almost through the production cycle. So there is no indication of duration or dosage of the IGP. So we were not really able to quantify, but this comes at the top of what the figures I showed you. That didn't take into account the IGPs. There was huge variation in recommended doses in SPCs. One company is reporting, for example, for amoxicillins, a different dose, and the other company for the same active substance was reporting a different recommended dose. Yeah, I know it could be a difference in the efficacy of the drugs, but still it shouldn't be really much different. For example, for one drug, it was 4 to 26 milligram. It's a huge difference. It's the same active substance. Different companies are reporting different recommended dose. I think it's also confusing for the farm veterinarians which dose they should follow, because they are relying on the SPCs. So the next, there was also inconsistencies in the units reported. As I talked earlier, it should be milligram per kilogram body weight, but here we see a lot of other units are being reported in SPCs. So the dose-based metrics, they were different with the one we have in Europe. So that says, while quantifying antimicrobial use in Pakistan, I saw some studies, they have used European Medicine Agency values to quantify antimicrobials in Pakistan. So our results are really different with them, because for Pakistan, the DDT values are really different than the European ones. So I think this could be a good, this could be used in initiatives on antimicrobial use in Pakistan. The methodology we developed to make the dose-based metrics it can be extended from to other species. So just the last slide. Areas to be improved. As I said earlier, we need to really revert this sequence. And then the variation in recommended doses, it should be, I think, regulatory oversight should be there. The structural oversight from the regulatory authorities can really address in harmonizing the recommended doses. And maybe it's also time to see the consumer preferences, because that makes the poultry industry really volatile. What the policymakers can do, we should start the rest of the world. I think at least the Western countries, there are no AGPs allowed in the animal production. So we can not really put it off, but we can start restricting the antimicrobial use and then eventually phase out the critical ones and AGPs. Then we really need to improve the registration process of antimicrobials import. We need to establish SPCs for the antimicrobials, because relying on the SPCs from companies, that is the mess. I told you, it's a different recommended dose for the same active substance for the same species. So if the regulatory authorities do this job to maintain the SPCs like they have done for human medicine, they need to do this for the veterinary medicine as well. So, and expanding this list, we should establish a national level. This data is based on the 100 farms, but we can do it for the whole country. So we have both of these papers published. If you are interested in further reading, you can scan the codes. And thank you. I really thank my professors, Jeroen Gewolf, his works in animal biosecurity, and Professor Ilyas Tenziaris, and my whole team. We are a group of 13 researchers with a veterinary epidemiology unit at Ghent University. And thank you to all of you for listening. If you have any questions.